Okay, what do you want some mobs on? Ankle? Okay, so
the ones on the pedestal.
lay down. Well, they can all be on there, right? Go ahead and lay down so they can see. Okay, so let's say her limitation is dorsiflexion. Which way am I going to move her? Down, okay? So, what's open pack position? 10 degrees of plantar flexion. Okay, I'm going to do slight traction and then I'm going to move posterior. I'm going to move down, okay, if her limitation is dorsiflexion. Obviously, if it's plantar flexion, then I'm going to move anterior. Okay. I think shoulder is probably the one that's scariest for you guys, so I'll show you that one. Let's say if her limitation is flexion, what are my options? Inferior and posterior. Okay, so inferior, relax. What's open pack position?
15 degrees of flexion. 30 degrees of reduction.
Make sure you know it. Kevin's the only one I hear. Okay, you're going to come here. I'm going to grab right below her elbow and I'm just turning my hips. Okay, so you're taking the head of the humerus and drawing it inferior. And this one's more of a hold. You're not going to be doing the oscillations there. For Maitland, what's the rate?
3 to 5.
1 to 3 per second. I know it. Right. Posterior, relax. Okay. I'm going to use my left hand here for traction. It's posterior, lateral, anterior, medial. So I'm slightly angulated there, right? Think of parallel to the treatment plane. Okay. And then I would do my moves there. Okay. For anterior, right, you can have them flip over. Or you can do it this way as long as you have somebody stabilized. You can have her come up this way. Okay, so go ahead and flip over there. I'll show them anterior that way. Remember, you're still going to have the same loose pack position. I like to use my leg to support them. I'm going to take this hand to do traction. Remember I said anterior, medial. Move over a little bit more. You're here. Okay, and then you would do your moves there. Okay. Why would you do an anterior move?
Extension of rotation.
Extension or external rotation. Okay. What else?
Knee.
Knee? Okay. What's open pack for the knee? 30? 25, 30 degrees. So if you have a wedge, it'd make it easier. So let's say the limitation is flexion. Which way would I move the tibia? Flexion. Down. Okay, for extension, the tibia comes up. For flexion, the tibia goes down. Okay, so I would just do traction. I'm going to walk out, and then I would do my moves right there. She would be lying down. Because it'll be easier to get them to relax. This sweater has too much give to it, right? From here. For extension, you can do here, anterior. Okay, but what would probably be easier for you guys? Yeah, and then move down here on the femur. The finger is the same. It's a mini knee, right? Okay, what about the wrist? Let's say her limitation is wrist extension. Which way are you going to move?